Hello everyone, how are you all? Today I am going to deal with some of the new questions that are frequently repeated in our nursing officer exams. So let us start without any delay. The most common deficiency seen in patient with the chronic alcoholism. Option A thiamine, option B vitamin D, option C vitamin C, option D cyanocobalamin. Actually, first of all, if we consider the chronic alcoholic patients, what happens in them? They will continuously habituate to that alcohol. So all the systems are going to deteriorate in them. Gradually, their digestion process are leading to further complications and gastrointestinal related, renal related, integumentary related. Every body system will be altered. So here in this, what happens means in chronic alcohol patients, the intrinsic factor will be there. Here, due to that, the intrinsic factor can't be able to convert into thiamine. So there will be the deficiency seen in chronic alcoholic patients. So here the option is option A, thiamine. Correct answer is thiamine. In chronic alcoholic patients, thiamine deficiency will be seen. So here a little bit explanation we'll see about these vitamins. Mainly these vitamins are categorized into fat soluble and water soluble, right? Mainly these are categorized into two types. First one, fat soluble, and the other one is water soluble. Fat soluble in the sense it is of again different types. It is categorized into four. Majorly it is fat soluble are of four vitamins. Vitamin A, vitamin D, vitamin E and vitamin K. A, D, E and K. So vitamin A, it is also called as retinol. Vitamin A is also known as retinol and the normal range is about 600 to 700 micrograms. The normal vitamin A ranges up to 600 to 700 micrograms. And due to this deficiency, what happens? Due to vitamin A deficiency, it mainly leads to night blindness, xerophthalmia, bite spots. These are all the things which are related to the vitamin A deficiency. Next, coming to vitamin D, it is also known as cholecalciferol. Vitamin D is also known as cholecalciferol. And the normal range is about 100 international units, 200 international units and 400 international units. 100 will be seen in adult. The normal range will be 100 and in children the recommended requirement will be 200 and 400 international units in pregnancy and lactation. Then fat soluble vitamin E. Vitamin E is also known as tocopherol. And the normal range is about 10 mg. And vitamin E, you all know about this now. It is also referred to as anti-aging vitamin. Then final one, vitamin K. Vitamin K is also known as phenoquinol. The other name of vitamin K is phytodione. It is normally usually given at birth. So these are all the things regarding fat soluble. Vitamin A, it is also known as retinol and the normal range is about 600 to 700 micrograms. And this deficiency, it leads to xerophthalmia, white hot spots, night blindness, like that. This deficiency causes. Then second one, vitamin D. It is also known as cholecalciferol, and the normal ranges recommended recommendations of vitamin D is 100, 200 international units and 400 international units. In adult, the recommended dietary requirement is 100, and in children 200, and pregnancy and lactation it requires about 400. Next one, vitamin E. It is also known as tocopherol, and the normal range is about 10 mg, and it is also known as anti-aging vitamin. And final one in fat soluble vitamin K, it is also called as phenoquinol. The branded item which are available in market was phytodione. It is usually given at birth. Then we will see about the water soluble vitamins. Water soluble vitamins are of B1. It is also known as thiamine, and the normal range is about 1.2 to 1.6. Vitamin B1 is also known as thiamine, and the normal range is about 1.2 to 1.6. And this mainly, this B1 thiamine deficiency leads to wet beriberi and dry beriberi. And in chronic alcoholic patients, we had already seen the thiamine deficiency will be seen like that in the question. And here it leads to Wernicke's encephalopathy. Wernicke's encephalopathy. Korsakoff syndrome. It is mainly seen in this chronic alcoholic patients. It is all about vitamin B1, thiamine. Then second one, B2, it is also known as riboflavin. Vitamin B2 is also known as riboflavin, and the normal range is about 1.4 to 1.8 mg. Here, this riboflavin deficiency mainly leads to angular stomatitis. Third vitamin, B3. B3 is also known as niacin, and due to this deficiency, it leads to pellagra. And normal range is about, in B3 deficiency, 16 to 20 mg. And here, mainly the frequently repeated question in exam in B3 niacin, they will ask about 4Ds due to the deficiency of B3. It is represented by 4Ds. 4Ds means dermatitis, diarrhea, dementia, death. These 4Ds indicate the deficiency of B3, niacin. Then next one, B5. It is also known as pantothenic acid. This B5 is also known as pantothenic acid, and the normal range is about 10 mg, and it affects on neural health. This pantothenic acid deficiency mainly affects on the neural health. Then next vitamin, B6. B6, it is also known as pyridoxine. And in case of using anti-tubercular drugs, the deficiency due to isoniazid. Here, in case of the using the anti-tubercular drug like isoniazid, here what happens, this deficiency may cause, like pyridoxine deficiency may cause, and it leads to peripheral neuropathy. Peripheral neuropathy. And this B6 normal range is about 2 to 2.5 mg. B6 deficiency, the pyridoxine deficiency leads to peripheral neuropathy, and here the normal range is about 2 to 2.5 mg. Then next vitamin is B7. B7 is also known as biotin, and biotin plays a main role in the hair growth. Due to this B7 biotin deficiency, the hair fall may cause. Next vitamin B9. B9, it is also known as folic acid. The folic acid normal range is about 100 mg, and the main deficiency leads to megaloblastic anemia. It is always correlated with this B12 deficiency. In this B9, due to folic acid deficiency, it leads to megaloblastic anemia and ultimately leads to neural tube defects. So in pregnancy, before conceiving, if the married couple are planning to conceive, before 3 months itself, they need to start folic acid in order to prevent the neural tube defects. Then final one, B12. Final one is B12. It is also called as cyanocobalamin. And if the deficiency of this B12, it causes pernicious anemia. Pernicious anemia. Here, due to vitamin B12 deficiency, it leads to the pernicious anemia. So, let us review with this again. This vitamin B12 normal range is about 200 to 300 pg per ml. Pg means picograms, pg per ml. So let us review this topic again. B1, it is also known as thiamine, and the normal range is about 1.2 to 1.6. Due to this deficiency, it mainly leads to Wernicke's encephalopathy, Korsakoff syndrome, and other one, Wedderberry and Dryberry will be seen. This both both diseases will be seen in chronic alcoholic patients. Due to this, thiamine deficiency will be seen. Next, B2, it is also known as riboflavin, and due to this deficiency, it leads to angular stomatitis, and the normal range is about 1.4 to 1.8 mg. Then next one, B3, it is also known as niacin, and this main deficiency leads to pellagra. Normal range is about 16 to 20 mg, and here the most repeated question which was used in this, it represents 4 Ds: dermatitis, diarrhea, dementia, and death. Next, B5 pantothenic acid, and the normal range is about 10 mg, and due to this deficiency it leads to neural problems. So it mainly concentrates on the neural health. Then next, vitamin B6, it is also known as pyridoxine. The normal range is about 2 to 2.5 mg, and due to this deficiency peripheral neuropathy happens. Then B7, it is also known as biotin, and it mainly maintains the hair growth. So this deficiency leads to hair fall. Next one, B9, it is also known as folic acid, and the deficiency leads to megaloblastic anemia, and normal range is 10 mg. And final one, B12, it is also known as cyanocobalamin. The main deficiency of B12 cyanocobalamin leads to pernicious anemia. The tongue reflects a red beefy tongue like, and the normal range is about 200 to 300 picograms per ml. So this is a small explanation about this vitamins, fat soluble and water soluble. So we will see some of the clinical features of this vitamin B1 deficiency. There are mainly clinical manifestations that show tingling in arms and legs. There is a prickling sensation around arms and legs, and nausea and vomiting. There will be the GI disturbances and loss of appetite. The client will have the loss of hunger and irritability. They are if they are trying to concentrate on one particular topic, but they are not able to concentrate on that. They get irritated easily. And blurred vision, they can't able to see the things clearly. Fatigue and delirium. What do you mean by delirium? Delirium means it represents the mental state of a person in which the person will be disoriented. Orientation means the person will be able to know where he was, what is the time, where is the place he was, like that the person will be oriented. But in case of delirium, the person will be completely in a confused state of mind. They are not able to answer properly whatever we are asking, and disoriented. They are not oriented to time, place or person, and not able to think or remember. Whatever they are thinking, they think in their own way, and they can't able to remember easily. This all represents delirium. These are all the clinical features which represents the thiamine deficiency. Next question. Pulsation felt in vagina through lateral vaginal fornix, an early indication of pregnancy. Option A, Osiander sign. Option B, Jacquemus sign. Option C, Godel sign. Option D, Chadwick sign. So, did anyone of you heard about this pulsation in the vagina which will be felt at lateral vaginal fornix? First of all, we will see the answer here, and later we will go for explanation regarding this all the signs regarding what are the presumptive signs, what are the probable signs. So we will see in detail. So here the answer is Osiander sign. At vagina through the lateral fornix, the pulsation felt is called as Osiander sign. Yeah, by looking at the signs of this, some of the signs, we can't able to say clearly that the client is pregnant. It just shows some of the signs that it indicates pregnancy, but we cannot be sure by seeing these signs. So let us start this. Probable signs of pregnancy. In pregnant condition, there may be the probable signs and presumptive signs. Probable signs in the sense they just show, but it's not complete evident. But whereas presumptive signs, basing on that, we can clearly say that the client is pregnant. So the probable signs of pregnancy you will see. First one, Goodell's sign. Goodell sign means what? It can be felt at the 6th week. The Goodell sign felt at the 6th week. And if we are trying to touch our lips, how we will feel it as a soft. So in Goodell sign also, like our lips, the softness, how we felt in Goodell sign also, at the cervical region, the softening will be felt. The Goodell's sign indicates softening of cervix. Softening of cervix. Thus, it indicates Goodell's sign. Here, whatever I am going to explain, they are trying to ask any one of these signs in the examination. So, please try to concentrate on this. Next sign, Hegar's sign. Hegar's sign. Hegar's sign usually felt at the 8th week. And here, how we will feel this Hegar's sign will be felt through the bimanual examination. By using both the hands, we can feel this sign. Here, what happens? One hand should be kept at abdomen. Later, we will see through this Hegar's sign through some diagram. So that you can remember it easily. One hand will be kept on abdomen and the other hand will be inserted through the vagina. Other hand will be inserted through the vagina. Then during examination, what we need to observe? We need to feel the lower uterine segment. At the lower uterine segment, we will be able to find that softening of isthmus. Softening of the isthmus. So in Hegar's sign, what we will observe majorly, it can be observed in 8th week. Here, during the bimanual examination, one hand need to be kept on abdomen and the other on the vagina at the lower uterine segment so that we can feel the softening of the isthmus. It indicates the Hegar's sign. Here, we are doing this examination through bimanually. One hand kept on the abdomen and the other one inserted through the vagina. And here we are feeling this. It is the upper uterine segment. It is the lower uterine segment. So here we are feeling at the lower uterine segment. There will be the softening at the isthmus area. So this sign indicates Hegar's sign. Next sign, Palmer sign. Did anyone heard about this Palmer sign? So here, during the labor, we usually heard that there will be the contraction and relaxation. But in case of this pregnancy period also, from 4th week to 10th week, we feel this Palmer sign. From 4th week to 10th week, what happens? There will be the continuous contraction and relaxation alternatively. contraction and relaxation, and it continues at around 30 seconds. 30 seconds there will be the contraction and 30 seconds relaxation, and again 30 seconds contraction, then again relaxation. If we consider it as a graph, there will be the continuous contraction and relaxation, and it is about 30 seconds and relaxation is also about 30 seconds. This is initially only seen about 4th to 10th week, just a mild 30 seconds it will be. That it indicates Palmer sign. During contraction, what happens? There will be the hardness feel of this during contraction, and during relaxation, we'll feel it as a soft. Then next one, Osiander sign. Osiander sign. Osiander sign means we had already seen in the question. There will be the pulsation at the lateral fornix of vagina. At which age we can able to see this Osiander sign? Lateral fornix of vagina. In Osiander sign, what happens? There will be the pulsation at the lateral fornix of vagina, and it will be seen about 8 weeks. Next sign, Chadwick sign or Jacques-Wimer's sign. Chadwick sign or Jacques-Wimer's sign. Here, this Chadwick sign will be seen at 8 weeks. And here what happens? If normal client, if we take, the vaginal part will be looking pink color. But in case of pregnancy, what happens? There will be the increased blood supply due to the pressure over the lower parts of the body. There will be the increased blood supply. It leads to vascular congestion due to the increased pressure. So, as the vessels are congested, like they shows, there will be the bluish discoloration. Bluish discoloration will be seen. It is also known as dusky hue. This bluish discoloration looks like dusky hue. So, Chadwick or Jacques-Wimer sign, one and only same, one and both are same, and it will be felt at 8th week, and due to the increased blood supply, there will be the pressure over the lower regions, so there will be vascular congestion and it leads to the bluish discoloration of the cervix. It also known as dusky hue. Next sign, Ballatment. And Ballatment is of two types, internal Ballatment and external Ballatment. What do you mean by internal Ballatment? Internally, what happens? Through the vagina, if we are trying to push the cervix at around 16th to 28 weeks, what happens? The fetus will move backward and it bounces to front again to its normal position. That is about internal Ballatment. Whereas in external Ballatment, what happens? If we are trying to keep one hand pressure and one, if we consider one pregnant lady to lie on a bed, and if we are trying to keep both our hands on lateral sides of the body, lateral sides of the abdomen,
we need to keep from one side. Some mild push must be kept, not excessive pressure. Only mild push must be given. Then other hand was placed, which was on other side. What happens here? The baby slowly moves to other sides and touch other side abdominal wall, and whatever our we kept our other hand to the other side, it will be felt and it bounces back to its normal position. So it is known as external ballotment. Then other one, uterus height enlargement will be seen. Uterus height enlargement. So based on this uterus height enlargement, we can easily identify that how much the uterus was growing and at which age we can able to identify. Here we will see through this diagram. Here, this is umbilicus nerve. At symphysis pubis, just around the at 12 weeks, it will be at symphysis pubis. And at 20 weeks, it reaches between the umbilicus and the symphysis pubis. At 20 weeks, it is between the umbilicus and the symphysis pubis. And at around 24 weeks, it is seen at umbilicus. It is the frequently repeatedly asked question that when was the time the uterus size reaches up to umbilicus. At 24 weeks, it reaches up to umbilicus. And next one, 28 weeks, just above the 1/3 of the umbilicus, the uterus height reaches up to 28 weeks. Then 32 weeks. 32 weeks means above 2/3 above the umbilicus. It is about at 28 weeks, it is above 1/3 of the umbilicus, and at 32 weeks, it is about 2/3 of the umbilicus. And what it indicates, it is about, it indicates this xiphoid process. From up to here, the xiphoid process will be present now. At 30 weeks, it reaches up to the xiphoid process. The xiphoid process also known as ensiform cartilage. Here, what happens? It reaches up to, at 36 weeks, it reaches up to xiphoid process. Then again, at 40 weeks, it slightly reduces to some nearly down to up to 32 weeks. It again reduces somewhat. So based on the uterus height increase or enlargement, we can able to identify that fetus is at which age. So let us see this again. Goodell sign, it is about at felt at 6th week, and here what happens, there will be the softening of the cervix, like how we feel the lips as soft as like that. So at cervical area the softening will be felt. That is Goodell sign. Hagar sign means at 8th week during bimanual examination, by using both the hands, one hand should be kept on the abdomen and other hand will be inserted through the vagina. We need to reach about this lower uterine segment during the examination, and softening of the isthmus will be felt. Next sign, Palmer sign, it can be felt at 4th to 10th week, and during this the contraction and relaxation happens every 30 seconds. It will be alternate, like 30 seconds contraction and 30 seconds relaxation. Next, Osiander sign. Osiander sign means the heart pulsation felt in the lateral fornix of vagina. Then Chadwick sign or Jacquemus sign, it is felt at 8 weeks, and here what happens, due to the increase in the blood supply, there will be the more pressure over the lower region, lower parts of the body. So there will be vascular congestion and bluish discoloration of cervix will be seen. Here it indicates as a dusky hue. Then next one, ballotment, and ballotment is of again subdivided into two types, internal ballotment and external ballotment. In internal ballotment, we need to examine through the vagina, and just we need to push some little at the cervical area, and it usually felt at 16th week to 28 weeks. The fetus just slightly move back and return to its normal position. Just will feel the fetus movement. And external ballotment means the we need to place the pregnant lady on the table, and by using both hands, both hands are kept on two lateral sides, and by using one hand, slight pressure must be applied, and the baby will be moved to the other side, which we had already kept the other hand. So the baby touches that other part of the stomach and rebounces to its normal position. So, and final one, by using this uterus height enlargement or increase also, we can easily say that how at what place it reached during different weeks. At 12 weeks, it will be at symphysis pubis. At 20 weeks, it will be between umbilicus and symphysis pubis. At 24 weeks, it reaches up to umbilicus. And at 28 weeks, it is above the umbilicus 1/3. And at 36 weeks, it is about 2/3. It reaches above the 2/3. Like that, it will be completely at 32 weeks, it will reaches around above umbilicus 2/3, and at 36 weeks, it reaches up to the xiphoid process. These are all the things which was about this different signs which can be shown in pregnancy time. Next one, which immunoglobulin cross placenta? Option A IgA, option B IgG, option C IgE, option D IgM. So, one question will be given compulsorily from this. What is the immunoglobulin, or which immunoglobulin helps in showing hypersensitivity reaction? Like that, differently they can be asked, which is the immunoglobulin which is found mostly in the saliva. So just a single line explanation we'll see regarding this immunoglobulins, and here we will see the answer first. This which immunoglobulin cross the placenta means it will be mainly IgG. So the correct answer is IgG. Just we will use some mnemonic in order to remember this all the 5 immunoglobulins. We will just use this mnemonic GAMDE. IgG, IgA, IgM, IgD, and IgE. First of all, we'll see about IgG. It is abundant. It is found mostly, and it crosses the placenta. This immunoglobulin IgG, it will easily cross the placenta. Then next one IgA, it is mostly found in breast milk. This IgA mostly found in the breast milk, body secretions, and saliva. Then third one, IgM. IgM, it is also known as macrostructure, because while comparing all these immunoglobulins like IgG, IgA, IgM, IgD and IgA, IgM is the one of the macrostructure. It is a megastructure. So it mainly helps in the showing primary immune response. This IgM plays a major role in primary immune response. Next, we'll see about IgD. IgD, it mainly focuses and found on body surfaces. This immunoglobulin mostly found on body surface. And finally IgE, it plays a major role in case of allergy. And any one of you ever heard about the hypersensitivity reaction? What do you mean by hypersensitivity reaction? For example, if we take into consideration one small drug, if we try to inject that drug to some person, if the person's body doesn't fit to the drug, what happens? Immediately the person's face will become red and immediate reaction will be seen. So what it shows? Allergic reaction. So here in this immunoglobulin IgE, it acts as a immune response, immediate immune response. So we'll call it as hypersensitivity reaction, and especially in this IgE plays a major role in performing this type 1 hypersensitivity reaction. Hypersensitivity reaction. These are all about this immunoglobulin. Mainly we'll call it as GAMDE. In order to remember this, we'll just remember with this mnemonic. IgG, it is most commonly found and abundant, and it just easily crosses the placenta, IgG. And second one, IgA, it mostly found in breast milk and body secretions and saliva. And next one, IgM, it is one of the macro structure when we compare all these immunoglobulins, and it plays a major role in the primary immune response. So IgD mostly found on the body surface area, and IgE plays a major role in case of allergic reactions, and mainly it plays the important role in type 1 hypersensitivity reactions. So this is all about immunization. Sorry, this is all about immunoglobulins. Next one, dilution. What do you mean by dilution? Can anyone define this dilution? Option A, thought. Option B, perception. Option C, insight. Option D, cognition. Delusion. Delusion means generally it indicates unshakable belief. Means it is a false belief. What it represents? Some false belief that someone holds despite evidence that it's not true. But the person may believe that it is good or it is correct, like that some false belief that itself represents delusion. So here this delusion is a thought disorder, because what thought represents? It represents the mental health condition of a person, because this thought impacts person's ability, like how the person is thinking, how the person is going to speak, how the person is communicating with the others, they are speaking clearly or not, like that. The thought itself represents the health condition of a person. So delusion also, it is a false belief that someone holds despite the evidence. So here the delusion is a disorder of a thought process. The correct answer is thought. This perception. Perception means what? If we are going on a road, for example, if we are going on a road, we are passing on a road, we will be able to identify something. If suppose, for example, if we consider some accident happened, just we can't go through like that, na? We will see that what happened there, accident happened, did any injury, like that we will think easily. By observing that thing, we can able to perceive that something happened over there, like that how we are perceiving the or noticing something whatever was happened, that is perception. Then option C, insight. Insight means a clear cut idea regarding something. For example, if we are going to study BSc nursing, what is our primary goal? In order to earn good job or in order to settle in our life, we can easily get job through the profession. Like that, we will have different insights. A clear goal, like that, it represents insight. A deep understand of what something is like. We have clear view. We have clear understanding. Okay. Then cognition. Cognition means it is understanding through the thought, how we are thinking, how we are experiencing the things, how we are sensing the things. Like that, it is a process of acquiring the knowledge. This cognition means the process of acquiring the knowledge. Again, this delusion is of different types. By differentiating some things, we can easily see this. So this delusions is of mainly categorized is into four based on this belief. First one, grandiose delusions. Grandiose delusions. What do you mean by grandiose delusions? We'll have the belief that someone is famous, someone is more powerful. We will just think the other person is more powerful than me, the other person is more rich than me, the other person is more famous than me, he's more he can be able to do all the things, we can't able to do the things. Like that, we'll have some belief, that is grandiose delusions. Either other person is low also, we will think, we'll just believe that, like that, that other person is more rich, powerful and famous. Then second one, paranoid delusions. Here we'll consider other person as powerful, famous and rich. Then next one, paranoid delusions. Paranoid delusions means we will think that they want to harm that person. Like that we will think. Here in paranoid delusions, sorry for the delay. Here we will think that this paranoid delusions means want to harm the person. They will have the belief that they will harm that person, they will harm me, like that they used to think. Okay, harm the person. Next, third one, somatic delusions. Somatic delusions means there will be the belief that something is wrong with the body, like they are having the missing body part. They just believe like that our body part was missed, where is that, like that they will think. They just believe that there is something which is missing, like missing the body part, missing something. Like that they will have the belief, that is somatic delusions, like one part is missing, like that they will feel. Then final one, delusional jealousy. Delusional jealousy. This delusional jealousy, here the belief will be unfaithful. Here, if we consider some married couple, the partner will have the unfaithfulness over the co-partner, because he won't believe easily on his partner, because he's unfaithful to me, he is not clear to me, he is hiding something from me, and they are having some external extramarital relationship with others, they are not loyal to me, like that they will have that belief. It's not true, but they believe that the partner is unfaithful to her, like that they will believe. That is delusional jealousy. These delusions are of mainly categorized based on the belief, mainly four types: grandiose delusions, paranoid delusions, somatic delusions, and delusional jealousy. In case of grandiose delusions, what happens? The person may believe that someone is powerful, famous, and rich. And in case of paranoid delusions, what happens? They want to harm the person. They think that they will have the belief that they will harm the person. Then third one, somatic delusions. In case of somatic delusions, what it represents, there is a belief of something is wrong. Some body part is missing, like that they will think. And final one, delusional jealousy. In this, the partner will think that the own partner is unfaithful to her, that they are not loyal to them. They believe that they are having some relationship with others, like that they used to think. They just believe that. They won't believe it as a true. Next question in this session, it will be the last question. Immunization is option A primary prevention, option B secondary prevention, option C tertiary prevention, option D disability limitation. This immunization, where it comes under? The correct answer is primary prevention. First of all, what do you mean by prevention? Based on the community guidelines, it is mainly classified into four types: primordial prevention, primary prevention, secondary, and the tertiary prevention. First of all, first we need to prevent the problems or getting the diseases, so that we can easily survive. So this prevention levels indicates how we can able to cope up with the situation, how we can easily identify the conditions. Mainly we will see this more in the community. So here we will go through small explanation with some diagram. First of all, primordial prevention, primary prevention, secondary, and the tertiary prevention. In primordial prevention, what happens? We need to maintain the health by reducing the risk. What is the risky things? Because if the blood pressure increases, there will be the heart issues and renal issues. So first of all, we need to control and maintain. Not we we need to avoid the things which are elevating the BP. And here in primordial prevention, maintaining the appropriate weight, BP, blood glucose, lipid levels, means fat levels. If fat levels rises, what happens? There will be the increase in the cholesterol and heart diseases will happen easily. If the glucose levels rises, the person may able to get diabetes. And we need to eat well and doing regular exercises, and smoking is prohibited in this. So primordial prevention means first itself we need to avoid the things, thus maintaining the health and avoiding the risk. Next level, primary prevention. Here either we need to reduce or completely we need to eliminate the risk from our life, so that we can avoid these clinical conditions by using the drugs. Like if the person's BP is going to rise, we need to use the drugs as early as possible, so further BP rise may can't be increased. Maintaining appropriate BP, lipids, glucose, and stopping the smoking is mainly indicated. Then coming to the next one, secondary prevention. Here, what it indicates, after getting the disease, what we need to take care. First itself, we need to diagnose the condition with what disease the person is getting suffered. Like that, we need to observe the clinical manifestations, and early diagnosis and receiving the treatment is indicated. And non-invasive interventions may be performed here in case of secondary prevention. And finally, tertiary prevention. there is no other option. Compulsory, they need to go for surgery or any rehabilitation things, like they need to reduce the risk. They need to reduce the impact, how the disease can be reduced easily. So by minimizing the impact of chronic and the clinical conditions, by performing the surgeries, by going for surgeries, and by using the rehabilitation techniques, the person may use this tertiary level of prevention. So now the question indicates the immunization comes under this primary immunization. For example, in case of if we consider some girl child like 9 to 14 years, the girls nowadays the government implemented this vaccination program for different conditions. In case of primary prevention, if we consider at age of about 9 to 14 years girls, there will be the use of vaccine like Gardasil. So it is the primary level of prevention. And whereas in secondary prevention, what it comes, pap smear, early screening, these all comes under secondary prevention. And final tertiary means after getting the disease, what are the treatment options available? We need to go for the treatment purpose. So let us end this session with this explanation. So if you are having any doubts or if you want anything else, please let me know, and please share your valuable ideas at the comment box. Thank you. Thank you, dear. So thank you, dear students.